I'm Zena Awesome, and this is Vandar Awesome. One of the really frustrating things we have with his care is all the moving parts for treatment and for his diagnosis. He needs to get an MRI, and MRIs are like a pain in the butt to get scheduled. I had the doctor put in a stat order for an MRI, which usually means 2 weeks. But when I called up, I got October 1st. So that's not soon enough. I have another MRI scheduled up in San Francisco for September 6th. That's this Friday. But that's 550 miles away. And if he's going to be getting another brain surgery, I don't really want to be traveling that far. And then they're probably still going to have to do another MRI down here, because when they do actual go in to pull out the tumor, they're going to have an MRI just before the surgery for the medical equipment and the whatever they use to help assist in the surgery. So we could end up driving up to San Francisco, getting the MRI, and then coming down here and needing to get another MRI. With him, an MRI takes about an hour, because they do with and without contrast, and then they do just a whole bunch of different slices, so they have to run the machine quite a few times. What's it like to be inside the MRI machine? Does it bother you?
No, not really.
Is it loud?
Yes, it's kind of loud.
And you have to stay still?
Yeah, more or less.
Do they put anything on your head to make you stay still?
Yeah, you have a hat thing.
So they actually clamp your head down?
Yeah, more or less, yeah.
So for some people that might be a little traumatizing to have their head clamped down and shoved inside a tube that's making a lot of noise.
Well, they are loudly. They are loudly.
But you've never had any problems?
None in particular.
But you hate the IV, right?
No, I don't like the IV at all.
Right. So that's just a little bit about the upcoming MRIs and some of my frustration in trying to get things scheduled.